Joining us for our virtual open enrollment fair session. At this time, we will go over Delta Dental benefits for plan year 2024. Before we get started, I would like to brief everyone on a couple of housekeeping items. All attendees are muted and will remain muted throughout the presentation. And if you have a question, please type it in the chat box located on the right-hand side of the presentation screen. All questions will be addressed towards the end of the presentation. Do be informed that if you do type a question in the chat box, everyone attending the session will see your question and your name. So if you have a question that is sensitive or confidential in nature, we recommend that you reach out to the County Benefits Division or your department's benefits ambassador. Lastly, today's webinar is being recorded, and a copy will be posted on the Benefits Open Enrollment website. At this time, I will turn it over to our presenter, Carrie Ord.
Thank you, Nedra. Well, I'm so happy to be here, everyone. I was real excited to know. I was telling Nedra I was raised in San Diego, and I love San Diego, even though I'm not living there currently. And so I love to do work either down in San Diego or even a virtual meeting like this. It's just near and dear to my heart. So what we're going to be doing today is we're going to be talking about your Delta Dental plans that are available to you, and also you know, some of the differences between the two plans that you are being offered. And you can ask questions at the end, however you whatever you feel like you don't understand, or I will be happy to go over it again. These are some of the things we're going to be talking about. We're going to learn about your plans. I'll talk about some of our resources, like our tech resources, the web and mobile resources. Also, there's a difference between the two plans that you're being offered, and we'll talk about those. We have some extra member perks, and of course, as always, we'll go over some oral health and wellness things, benefits that we have. So let's get started. Okay. We're going to start by doing a quick comparison of the two plans that you're being offered. Now, you're being offered a Delta Dental PPO plan, and you're being offered what we call Delta Care USA. And the Delta Care USA plan is akin to an HMO, like if you were going to do medical HMO. It's similar, works similarly to that, but it's for dental. So first of all, on the Delta Dental PPO, you'll be able to visit any licensed dentist, and that's pretty much any licensed dentist in the entire world. So if you're traveling, or if you're from another country and you may have a dentist there that you want to utilize, you can do that. And you would just submit your receipts and a narrative from that dentist, and we would reimburse you for your expenses. You would pay up front, and then we would reimburse you. So that makes the PPO eligible to be used all over the world. Your benefits on the PPO are subject to an annual deductible and maximum. The plan covers a huge range of services and no exclusions for most pre-existing conditions. So if you're missing a tooth or something like that, just because that you lost the tooth before you came to Delta doesn't mean we won't replace it. We want to make sure that you have good oral health, and in order to do that, you have to have missing teeth replaced usually. So you also have great preventive care, routine cleanings and exams, and those are covered at little or no cost to you. You just would pay the applicable co-insurance at the time of your service. So in order to keep the co-insurance low for you, we suggest always that you try and go to a Delta Dental PPO provider or a premier provider. If they're contracted with us, they're giving us a discount, which means you're getting a discount as well. And so your percentage wouldn't be quite as high if they're in network. Always a good idea. Orthodontic services are covered through the Delta Care USA plan, and you would use a Delta Care USA orthodontist. So in other words, on the PPO, you won't see You won't see orthodontic services listed on your benefit sheet, but you can get orthodontic services through the Delta Care plan, which is the HMO. So that's where you would go to find your orthodontist and get those services provided. Now let's look at the Delta Care USA. On the Delta Care USA, you need to select a Delta Care USA primary care dentist. So in other words, you have to use that network in order to use the benefit or have the benefit. On Delta Care, there are no annual deductibles or maximums. So on the PPO, you have deductibles and maximums. On Delta Care, you do not. And the plan covers over 300 procedures. There's no exclusions for most pre-existing conditions. So it works the same way as far as if you're missing a tooth or teeth or whatever before you got onto the plan, they would be eligible for replacement. Preventive care is covered. Routine cleanings and exams, again, has low or no co-payments. And you would just pay the applicable co-payment at the time of service with your assigned Delta Care USA provider. Delta Care USA plan is actually for you is offered in California for San Diego members, okay? So it's not in other states, it's offered in California. So I wanted to make sure that you understood that, which would mean to you if you have, for instance, children who are going to college in another state, you wouldn't have the Delta Care network in those other states. So you would maybe want to be on the PPO if you have college-age kids or kids living in out of state, out of California, because that way they would be covered. Okay. So we're going to go into a little more depth about Delta Care USA so that you'll understand it a little better. On Delta Care USA, you have all the benefits that you would require as far as your basic functional dentistry. You get quality dental benefits, and nice thing is that it's at an affordable cost, okay? It's a budget-friendly plan, easy to use, and under this plan, you'll enjoy more than 300 covered procedures, which is always nice. And some of those procedures, which a lot of times aren't covered under other HMO plans, you'll have general anesthesia and IV sedation on your plan. If you have kids that need orthodontics and maybe they have to have some teeth removed to make space, those extractions are covered. Occlusal guards and adjustments are covered. So if you are a grinder or a clincher or you have some TMJ, you can get an occlusal guard on this particular plan. If you're missing teeth and you need to have fixed bridge work done to replace those teeth, that's covered. I should mention that implants are not, however, covered on the Delta Care plan, but the fixed bridge work is covered. And then there's some highly utilized cosmetic procedures, which you don't see covered very often, like bleaching, and if you need an extra routine cleaning, you know, if you've used up your benefit for your routine cleanings and you need an extra one, there is a co-payment set for that. So there shouldn't be any problem with you getting that at a very reasonable co-payment, the extra one. And also the tooth-colored fillings on your back teeth, that's a covered benefit. So in the past, those have not been things that I've seen necessarily covered on the HMO plan, but they are covered on your HMO plan. So that's really good. And one of the best things is predictable costs, because you will know upfront what your co-payments will be for your covered services. And that you will find in your benefit booklet for Delta Care USA. And you can look at what the doctor is going to do, look straight across on the page, and you will see what your co-payment should be for that procedure. So that's always nice. No claim forms. Again, no deductibles or maximums. You can't max out this plan. In other words, there's not a set maximum. Okay, now how you're going to use this. First thing you're going to do when you sign up is you're going to choose your primary care dentist. And so you will go to our directory, and I'll tell you how to do that. And you will look for Delta Care USA Dental Network. We've got it all separated out from the PPO, so you shouldn't get mixed up with it. And you have to visit the selected primary care dentist in order to receive your benefits. So remember that. That's very important. You can't just say, well, I want to go to my old dentist, but I want to be on the Delta Care plan. If your old dentist isn't contracted to take Delta Care USA, then you won't have a benefit. So you want to make sure that you're doing that. So, going to the right dentist so that you will have a benefit. Once you've chosen your dentist, you're going to schedule an appointment. And then you can go ahead and make your visit. You don't need an ID card to receive treatment. You just need to give them your name, social security number, and your date of birth. And they will take care of everything else because they should have your information there already because you will be enrolled ahead of time for that office. The dentist will work with Delta to complete any necessary paperwork, so you don't need to worry about that. You don't need to worry about claim forms or anything like that. All you have to do is get your services and pay your copayment if you have one. Like I said, sometimes there's no copayment at all for the treatment. So you can access your benefit booklet and see if there is or isn't a copayment for your service. Okay, now this is how you're going to choose your dentist. It's not difficult. You're going to go to deltadentalins.com and select Find a Dentist. It's on the first page when it opens up. Say Find a Dentist, you click on that, and then it will take you to another page where you will see the different networks. Now you're going to choose Delta Care USA as the network for the dentist that you want to use. And when you click on that, you'll enter your zip code, and then it will bring up all of the Delta Care USA contracted dentists in that zip code. So maybe you want to go to a dentist closer to work. Maybe you want to go to a dentist closer to home. Wherever it is that you want to find your dentist, that's a zip code that you would use. And then you can choose from the list that comes up. Okay. And I think that this is one thing I would advise to anyone, whether you're taking the PPO or the HMO, make sure that you create an online account at deltadentalins.com. Through your online account, you can submit your request for the dentist that you want. You can ask questions right there online. It will go to customer service and you will get responses. If you want to pick up the phone and give them a call, for Delta Care USA, this number on the screen, 844-697-0579, that's the number that you would use to call customer service. Okay. Now, if you want to change your dentist, you just need to let us know by the 21st of the month, and you will be able to go to the new dentist by the 1st of the following month. So don't forget. You just let us know. You can let us know online. You can let us know by phone where you want to go, and we will change it in the system and make sure that that new dentist gets your information before the 1st of the following month. Okay. If you don't choose a dentist at all, when you sign up or when you enroll to be a member of Delta Care USA, what will happen is the system will go ahead and assign you to a dentist according to your zip code. Now, that's not really a problem, but it won't be the dentist maybe that you might have chosen for yourself. And it can be changed, but it's just another step that you would have to go ahead and try and find the dentist that you want to go to and then make a change through the system on where you want to go. So it's not a problem. You don't have to go to the dentist you're assigned to. It's just the system doesn't know what to do for you if you haven't given it the information. So it uses your zip code to make an assignment. Okay, so keep that in mind. Okay, if you have any kind of specialty needs, specialty care needs, your primary dentist will refer you. And so if you have children that need a pedodontist, or you need a root canal specialist or an oral surgeon, your general dentist will refer you there. And they'll request authorization for specialty services, and then you'll be referred to an in-network specialist who is contracted to perform those services for Delta, for the Delta Care USA plan. If you're traveling and you're out of your network, or you're in another state, or you have a toothache and you're visiting, family somewhere, and it's away from your home, you do have emergency coverage. And so that's pretty important to know. Typically, it's about $90 coverage per emergency per person. And so you just need to find a licensed dentist, get the emergency service, bring the receipt back to us, and we will reimburse you. Okay, so that's something that's pretty important to know, that you can get emergency care. If you're switching from another plan, for instance, this is your first year of going to Delta Care USA, and maybe last year you had, pardon me, you might have had Cigna, or Aetna, or some other plan, and your dentist has started work. Your dentist from the last year has started work, like, let's say maybe they started a crown. You needed a crown, and so they went ahead and did the preparation for the crown. And then before you got the crown delivered or seated, you ended up changing dental plans. Okay. So how that works is, you would go back to that same dentist, they would finish what they started, and that procedure would be billed to your old dentist, your old dental plan. So coverage for any new services that you need will begin with Delta when you start with Delta, but other things need to be finished under the previous carrier, because with those kind of procedures, they bill them out when they start them. And so they really need to finish delivering to you whatever you need, so that they can get paid for that, because they've already billed out for it. So that's something to keep in mind too. Okay. Now, one more thing is, if you're switching on your PPO, if you're switching from another plan to the PPO plan, if it's done by the 15th of the month, your PPO plan will start the 1st of the following month. So keep that in mind too. That's something that we sometimes forget about. Okay. Now, ortho is always interesting. The reason ortho sometimes gets complicated is because it's an ongoing treatment. And so if you are interested in ortho for your children or yourself, you're going to be able to go to the Delta Care USA network. And this is the only specialty where you will be able to choose for yourself without being referred, but you have to use the dentist in the network. So if you want ortho, you go to the directory for Delta Care USA, and there is a box where you can put specialty. And when you pull down the menu, it'll say ortho, and you will be able to actually go in and choose an orthodontist without being referred for your children or yourself, and go ahead and make your appointment and have your ortho done through that dentist. When you visit the orthodontist for the very first time, you'll get a detailed treatment plan, and it'll detail all your upcoming procedures and costs. You want to be sure that a lot of times they'll do a financial plan, and they'll show you what it would cost you every month for your ortho with your plan in mind. Okay, they'll compare the costs in your treatment plan and compare them to the Delta Care USA benefit booklet. And you want to make sure that you're being charged properly, and those costs are all listed in your benefit booklet. So you really you have access to everything with your benefit booklet on the Delta Care USA. Once you start your treatment with an orthodontist, keep in mind that it's really difficult to change mid-treatment. I mean, there are situations where maybe you move or something like that and you have to change, but if at all possible, just really try and finish your treatment with that orthodontist. I've rarely seen someone change orthodontists mid-treatment where the next orthodontist didn't say, oh, I don't do this method, I do this method because I was trained at a different dental school, and they want to start all over. And that's, that's really difficult when you've gone halfway through your ortho treatment and you have to change an orthodontist. So we really encourage you to try and stay where you are until your treatment is finished for ortho. Okay, this is a little sample of what we've already talked about. This is the Delta Care USA plan, and it shows you here that deductibles and maximums are 0. You don't have any on this plan. And your diagnostic and preventive services, which would be exams, x-rays, and routine cleanings. Most of those services are at no cost. You get 1 cleaning every 6 months. And again, if you need more cleanings than that, sometimes they'll say, well, you have a little inflammation, we better do 3 cleanings this year. You would pay for the 3rd cleaning, but remember, it's a covered benefit, so there's just a co-payment that you would pay for it. If you have basic services, which would be fillings, root canals, extractions, that kind of thing, then the co-pays vary on that, and that would be in your booklet. Or if you need major services, which would be, it would be partials, dentures, bridge work, let's see, maybe implants. But implants, I'm sorry, I apologize. Implants are not covered on the Delta Care plan. But those co-pays would vary as well, and those would be in your booklet. Okay. Now, we're going to go back to the PPO now. We're going to start talking a little bit about that and how to save costs when you're using your PPO. First of all, you want to make sure that you're going to a contracted PPO dentist, and you're going to find that out by going to deltacareins.com. And it's the same place, same way that you would do for your Delta Care plan, but it's for the PPO. So when you go in to find a dentist, and it will give you your list of different plans, you're going to choose PPO instead of Delta Care. And so that's where all the contracted dentists will come up. You put your zip code. You can actually do a search by any number of things. And as long as you're visiting a licensed dentist, you have benefit, okay? And you have a better benefit if they are contracted PPO. So keep that in mind, because on the PPO, you won't be charged more than what your expected share of the bill is. Okay, a couple of things about the PPO. You don't need an ID card to check in because the office will call and get your benefits for you, and that's always nice. If you have dual coverage, your spouse is covering you, you're covering your spouse, we'll help coordinate all of that so you don't have to worry about it. Sometimes it gets confusing. We'll take care of that. And again, I'm going to reiterate that it's really better for you if you create an online account and you have a user name and a password, and you can create that for your family, and you'll be able to access all of your benefits, your claims. If you go to see a dentist, they do the work you want to see. Is the claim paid yet, or where is the claim in the process? You'll be able to go into your online account and look at all of that. If you have a maximum on your PPO, a maximum amount that we will pay per year, you'll be able to check and see where you are as far as what your maximum is. It's really very advantageous for you. Okay. Oh, All right, well, here I'm eating my words right now. It looks like you have a third cleaning available on your PPO. So even on the HMO, you have 2 cleanings a year, and you pay a copayment for the third one. However, on the PPO, you actually have a third one covered. So that's nice. That's really nice to be able to access that third cleaning. But this little grid shows you what your deductible is. So you have a $50 per person deductible or $150 per family each calendar year deductible. And the deductible is waived for any preventive or diagnostic care. So you only pay that deductible when you're actually starting work, like services, fillings, that kind of thing. So you don't pay a deductible when you're just going in for exams and cleanings. You have a maximum every year of $2,000 per person each calendar year. And interestingly enough, your preventive care does not count towards that $2,000. So what that means to you is whenever you get preventive care or diagnostic care, that is being covered and not taken out of your maximum. So it gives you extra funds every year to use for other things that you need. Okay. Now what you'll see here is on your diagnostic and preventive services, they're covered at 100% in network. Remember, we have to stay in network to get the best value. You don't have to stay in network if you have a dentist that you really want to go to and they're out of network. You still have benefit, but you pay more out of pocket. So your basic services, fillings, root canals, if you have any gum issues, things like that are all covered at 80% in network. And if you need major services, which would be your crowns, bridges, implants, that type of thing, they're covered at 70%. So there's another little note on the screen that says the age limitation has been removed for fluoride treatment. Fluoride treatment used to be covered for children only, not adults, and so you'd have to pay an extra fee. But more and more dentists are actually using fluoride treatment for adults. So they've removed the limitation, the age limitation on fluoride, and as an adult, it's a covered benefit for you. Okay, now if you remember, your ortho benefit on your PPO is actually the ortho benefit that's on the Delta Care USA plan. So they've borrowed that, they've kind of borrowed that Delta Care USA plan ortho benefit, and they're allowing the PPO plan holders to utilize that. So this is a little grid of how much your ortho care would cost. These are estimates if there's anything unusual that falls outside of what these descriptions are for the ortho care, then they may have an extra charge. But you would know that up front. Okay. Now you can get a pre-treatment estimate on the PPO. So if you have some care that's going to cost you over, let's say $300, then you can do a pre-treatment estimate. You just have to ask your dentist for the estimate. And what they'll do is they'll send all the details to Delta. Delta will go ahead and work up the numbers as to what the dentist is going to charge and what their actual contracted fee is, how much Delta is going to pay, and what your responsibility would be. So you get a cost estimate ahead of time, and that will be sent to you and your dentist. And it's always helpful if you're on a budget of any kind, to know how much you're going to end up having to pay. Also, they'll take into consideration how much benefit you have left. Maybe you've used part of it that year. So they will do all of that for you and send you a cost estimate. Okay. Your emergency coverage on the PPO is worldwide, as I mentioned. Or even if you want to have dental work done out of the country, a big one is you're in San Diego. So there's a lot of people down in San Diego that I've worked with who go to Mexico and get treatment. They have their dentist in Mexico, and they want to continue going there. If you're on the PPO plan, you can do that. You just remember you have to pay up front, and then we will reimburse you for that. But you are able to do it. And the only thing that I can think of where you would use something like that is in San Diego. I mean, close to the border, maybe Texas, but on your PPO, you're able to do that wherever you go. So, and you just submit the claim for reimbursement. Okay. I think we already covered this about how payments determined when you're transitioning your care. It would work the same way as it does on the Delta Care, in that you would finish your treatment with the previous plan, under the previous plan, if it's mid-treatment, and then Delta will pick up anything after. As soon as you transfer to Delta, any new things that are started then would be paid by Delta. And that works the same way with your ortho coverage too. Of course, you're going to be using the Delta Care USA coverage anyway, so I don't think that will be a big problem with you because it's all the same coverage for orthodontics. Okay. Okay, talk a little bit about the Delta difference, just so you know. I love working for Delta. I was telling Nedra earlier today, I've been with them since 2005. And this is what I do. I love to explain the plans and help people understand them. This little piggy bank slide, what it shows is how your out-of-pocket expenses are determined. So when you have to pay a percentage, or not a copay, remember, but a co-insurance, this is how to make it more to your advantage. You'll see the big piggy bank, and what that means is that the dentist has given a bigger discount to Delta, therefore a bigger discount to you. So your best value would be to go with a contracted PPO dentist. Now, you also can use the Premier Network, and the Premier Network are contracted dentists who still give us a discount, but it's not as much as the PPO dentists. It keeps our network very large, gives you more choice of in-network dentists, but if there's a dentist you really want to go to that's on the Premier Network and not the PPO, you still get a discount. It's just not as big of a discount as the PPO, so you pay more out of pocket. Or you can go out of network completely, and we will go ahead and pay according to what we would pay the PPO dentists. But when the dentist is out of network, we have no control over what they charge. They can charge as much as they want, which is really, really a phenomenon. But once they do that, they'll take what we pay them and they'll balance bill you the difference between what Delta pays and what they want to charge. So keep that in mind. So that's your least advantageous way of doing it, is to go completely out of network. This shows you an example of what the levels of savings are. So on the PPO network, there's an average of about 39% savings. That's the discount we get. If you're in the Premier Network, it may only be 20% average discount. So again, it keeps our network huge, but you just need to know what's the best value for you. Okay, some of our extra perks that we've got, and you can find out about these by going to deltadentalinns.com/member perks. We've got virtual dentistry now, so you can actually have a consultation with a dentist over the computer, just like your telehealth. Brush Smart gives you savings on home oral health care products. So it's sponsored by Sonicare and Oral-B. Also, if you are having a problem, for instance, maybe you're taking care of an older parent or something, they're having a problem keeping their oral health up, they will give you solutions for how to help them be more successful at doing that. And also, if you have little children, it's the same thing. On Brush Smart, they have all kinds of solutions for how to help your children brush longer and better. We also have a couple of discounts for hearing aids and LASIK surgery. And you can get those discounts through Amplifon and QualSight. And again, you can access the information on the website. And Life Perks is discounts on different services that you may be interested in. So you can have a look at that and see if there's anything in there that you might be interested in. And wellness resources. So we've got online articles, recipes, videos. You can take a dental assessment of your oral health and kind of see where you fall as far as good, bad, middle of the road, whatever. You'll be able to take those assessments and understand better what your needs are. Okay, this is just a little example of the things that are on Life Perks, our Life Perks program. And you'll see that there's just all kinds of discounts. There's childcare, there's fitness memberships, entertainment, and some discounts on local and nationwide brands for various things. So you'll be able to look on that Life Perks and see what they've got on there that you might need or want. Okay, let's move on to the web and mobile. Check out the website, and you're going to go to deltadentalins.com/County of San Diego. And you'll search for your network dentist in your area, create your online account, as we've talked about a couple of times. You'll be able to get common answers to your dental plan. And also there's so many articles, recipes, videos.
Carrie, are you still there? I believe we got a technical challenge here. If everyone just stands by, I believe Carrie's system is frozen a little bit. Okay, thank you everyone for your patience as we scramble through the technical challenges here. What I will do is go through the chat box and answer as many questions as we can at this time. Um, let's see here. What happens when the maximum is reached? I believe that came from one of our employees regarding the PPO. I see a thumbs up, so I'm thinking that question may have gotten answered, but for all of you who are still curious about what happens when the maximum is reached, the maximum on the the maximum on the PPO is $2,000. That's the max you can expect to pay out of your own pocket. And once that maximum is reached, then the plan begins to pay 100% for any of your
Oh,
services.
Nidra, I'm sorry. Thank you for that. I just want to step in real quick, and it's actually the opposite of
Oh,
that. So the plan pays up to $2,000, and
yes.
you pay your copay, and anything beyond that will be an out-of-pocket cost to you.
Thank you for that clarification, Carly.
Yes, I know in the medical plans, it works exactly like that, but on
Yes,
the
that's what I'm
PPO
thinking
plan,
of.
it's the exact opposite, so I know it's confusing. So thank you.
Thank you. Sorry for that confusion. So as Carly mentioned, the plan pays up to 2,000. Let's see. Let's go to the next question here. Make sure we don't miss any. Are wisdom teeth extractions the same as general extractions? That is a takeaway question. I'm uncertain of how wisdom teeth are handled. I believe that's a yes, but we'll get a definitive answer for that question. And let's see, moving on to additional questions here. Where could we obtain a copy of co-pays for PPO services? Uh, that is another takeaway. I believe we can
Yeah.
obtain that from the benefits website for the dental plan summaries. So we can verify that and provide that information to you as well.
So Nidra, let me just step in on that one too. The PPO plan does not have designated costs. They have contracted costs with each provider. So it might be if you're in network, they might negotiate one price. If you're going to a premier provider, it might be another price. And then at a network, they charge whatever they want. So that's why they recommend that you do the estimate ahead of time so that you know exactly what you're paying for. On the HMO plan, we do have specific codes for the different um, items that are um, the specific items the that are going to happen, like a tooth extract or a cavity or what have you. So for them, they do have a code that you can look up, and those are set prices. So it's just a little bit different. I'm going to go ahead and keep on going if that's okay with you, Nidra. Okay, so somebody asked if they have a PPO dentist, if they need to select them again. And the answer is no. Under the PPO plan, you do not need to select a dentist. You go to any provider that you want. You just pay your out-of-pocket costs, whether it's in network, a premium dentist, or out of network, and then you submit your claim, like she had talked about earlier. Um, Does PPO cover ortho services? So for the PPO plan, it does not cover ortho services under PPO, but it is allocated under the HMO plan. So anytime you are trying to get orthodontic services, they need to be done through the Delta Care Orthodontic Network. So just please keep that in mind. And you call a different number when you um, use that plan. The PPO plan will not see the benefit, but they will see the benefit under the ortho. So I'm just going to put that in the chat so that you guys all have that available. And then I just lost my question, so give me one sec. Are dental services more expensive or more limiting performed by non-contracted PPO dentists? So if somebody is a non-contracted PPO dentist, they can charge whatever they want for their services. So again, if they're in network, they have a negotiated rate where Delta Dental has said you can only charge up to this amount. If you go to a non-contracted PPO, they can charge $100 when somebody else in the network might charge 25. So the answer is yes or no. It depends on what the dental provider decides to charge for that service. But Delta Dental doesn't have any control by them not being a member to be part of that. So I see Carrie is coming back.
Yeah, I lost you. I didn't even know I lost you. Do you know at what point I lost you in the presentation? I didn't know till I was finished that I'd lost you guys.
We caught you until you talked about the extra perks. So we're,
Oh, okay. You're
yeah,
good. You're good.
so we're near the end. So we were answering some questions.
Okay.
And so we talked about the PPO plan. You have to use the DHMO for the ortho.
Right.
If you
Right.
use an out-of-network dentist, that they can charge whatever they want.
Yes.
And so, and then we also talked about what happens when the maximums reach for the PPO. So Delta
Right.
Dental pays up to $2,000, and then
Right.
the rest of your cost is out of pocket.
That's good. I wanna expand on that just a tiny bit. So if you have maxed out your PPO amount, how that would work for you is if you still have things that are more urgent to finish before your next benefit starts, um, make sure that you go to your contracted network dentist to finish those things or get those things done, even if you're out of benefit, because they will only charge you the discounted amount. So if there's something that just can't wait, we don't want you to wait. If you've got an infection or pain or anything like that, you go to your contracted Delta dentist, and they will only charge you the discounted fee that they get from Delta. So you still get a discount off of what you would normally pay.
Because it's a negotiated rate.
Right, exactly right. Yeah.
Somebody asked if wisdom teeth were considered the same as a tooth extraction.
Yes, yes, it would fall under oral surgery.
Okay,
Mhm.
great. And somebody else was asking about a copy of the copays for PPOs, and we explained that since they're each negotiated with each dentist office, that
Mhm.
we can't provide that, but with the DHMO, we do have set prices and that
Yes,
they should do an estimate.
right. What you can do with the PPO is a pre-treatment estimate and find out what your treatment is going to cost you out of pocket. On the DHMO, they don't do a pre-treatment estimate, but you have your co-payments already listed and established on the HMO.
Okay, and then another question was, is there a way to get a list of dentists in Mexico? Is that on the PPO
You know
directory?
what? I don't think it is, and the reason that it isn't is because the dent, and so they don't put them into the directory. Usually, how people find their dentist in Mexico is through word of mouth. Like they have colleagues that they work with that go to Mexico, and probably in your situation, that's more often the case. Is that because you are closer, to Mexico than we are up in, LA or anything like that? You probably have more employees that use Mexico, and I would just ask them where they go and what they think and how their experience has been. Now, I will tell you that it's been quite a while ago, but I did some work in Mexico. I was trying to actually set up a network of dentists in Mexico, and I went down and I went through their offices and I interviewed them, and I established about 25 offices that were down there at that time that were excellent offices. They did holistic care. They had everything. They had to pass all the standards we had in the United States. Now, that was quite a long time ago. We really can't contract with them in Mexico, but you can utilize them. So if you have referrals from people that's probably the best way to find the best offices down there.
Okay, so Delta Dental does not host those because they are not part of the contracted.
No, and we can't. The reason we have to do it on a referral basis is because we can't pay across the international lines. So that's why you have to pay them, and we reimburse you on the United States side. We can't
Right.
like send checks across. And a lot of the offices now, there are so many offices now that are working with patients in the United States that they have actually set up small business offices in Chula Vista or in San Ysidro, and they will bill your PPO claims for you and accept payment, but they're on the United States side. So the offices that are the busiest, that take the most patients from the United States on PPOs, have actually done that. There's several. I'm not sure of their names, but I think, again, if you get a referral, you can always call and ask them if they will do that for you.
Okay. Another great question is Invisalign or Bite covered under Delta HMO? So that would be under the ortho, right? The Invisalign.
You know, Invisalign per se as a brand is not
It
covered.
actually, it is for us. We have it. We specifically
is?
asked that question.
Oh, okay. Okay. Well, that's good. That's great. Normally it is not, but I guess.
Oh, she froze again. Okay. And for clear aligners, Invisalign, Sure Smile, they should be submitted using the appropriate orthodontic procedure code. And then the benefit is based on the approved fee for the conventional orthodontics.
Right. Exactly. Exactly. Well, I'm glad to know that. Actually, I need to make a note of that. I hadn't realized that.
And one more quick note about the primary care dentist. They recently changed our plan where we do not get an auto-assigned primary care dentist. Once somebody goes to
on the Delta Care.
Once somebody
Okay,
actually goes to an in-network dentist, then they will be assigned that dentist as their primary care. They can still call in, they can still assign it online, but now they are not going to be auto-assigned.
Oh, great. Okay. Okay. Well, there you go. Two things. You guys are getting the royal treatment.
Another great question is what kind of information needs to be submitted if emergency dental work needs to be done overseas?
We need an invoice of what you paid. You can do the, you can figure out what it is in dollars, and we need a narrative from the doctor and the information on their license, that they are licensed in that country. And then you just bring that with you and submit it. I think you can submit it online now, and we will reimburse you based on that information.
Okay. And do you know if retainers or night guards are covered by the PPO plan?
Retainers would be covered on the PPO plan by being covered on the HMO benefit.
On the orthodontics. Okay, so
right.
I see removable.
And on orthodontics,
go ahead.
On the orthodontics, you do have your night guards covered. So yeah, they would be covered because that's covered under ortho.
All right, so it says removable orthodontic retainer adjustment is no cost, but the orthodontic retention, removal of appliances, construction and placement, and removal of removable retainers is $250, just to give an idea.
Right. Yeah.
How can we access the record of this presentation? It will be recorded and it will be available to you within a week's time. We also have the presentation that was done previously. If you wanted to hear another voice, it was done by a different presenter. Is the new third cleaning option for PPO members available for non-contracted PPO dentists?
Yes, it would be available because it is your benefit for non-contracted. But remember, you're going to you're going to end up paying more out of pocket for it because their fees are going to be, they're only going to be accepting what the discounted fee is from us, and they will bill you the difference between that and what their regular fee for a cleaning would be.
More great questions. So we also have, we've talked about this, but let's just re-emphasize that once we use up the maximum 2,000 benefit, do we still get the benefit of contracted price discount via Delta PPO? So as long as you're in network, correct?
Yes, yes, absolutely.
And just to summarize again, if there's no list of copays, how do we discern during open enrollment if PPO or HMO is more cost effective to us? Can you please send a comparison summary?
I think that's something that you probably should have there. I don't know if you've received it like in printed booklets from us, or if it's online for you as employees. I think maybe Nedrick can answer that. I'm not sure how they've done it.
Are you talking about the evidence of coverage?
I'm talking about the booklet, the benefit booklet for the DHMO. It's got all the co-payments listed in it.
Yeah, that's this one. I'll go ahead and post that in the chat. But again, it really just depends on what your treatment is and what you're doing and how much of it you're going to do during the year.
Yeah.
So there isn't a definitive answer. If you like knowing what the cost is up front, the HMO might be a good plan for you because you know exactly what you're paying based on the ADA code. If you go to the PPO and you stay in network, you know you're going to get the discounted rate if you go over the 2,000.
Now, let me also mention that if you are going to the PPO and you know what your treatment plan is going to be, but see, I don't know if you're making a choice now, you may not know that, but if you do know that, you can go online and we have the cost estimator. And actually how that would work for you is you would be able to compare contracted dentists' fees, because actually fees are established by zip code. So you may, by work, you might choose go to a dentist that's going to be such and such out of your pocket. You can go to the cost estimator and maybe go to the next town over or the next zip code over and look up that procedure there and see what the dentist's allowable amount is in that area. And they're still contracted, but the zip codes establish what their fees actually are, and they are different in every zip code. It might just be a few dollars difference, but that's how we figure it out and how they're contracted. So both ways you can get pretty close to knowing what it's going to cost you out of pocket using the cost estimator for the PPO and the benefit booklet for the HMO.
Another question is just to confirm, implant is not covered under either plan?
Implants are covered on the PPO. They are not covered on the HMO.
And if you don't use the 2,000 on the PPO, does it roll over?
No, it does not roll over. So it's $2,000 a year. And then at the beginning of your benefit year or your calendar year, it would give you a whole new benefit, but you don't keep what's left of your old benefit.
Great, thank you. If the retainer wire comes off, will the cement be covered by Delta Care Orthodontics Network by having a PPO plan? So I think this one is, you have to stay in, you have to use the ortho Delta Care in order to have that benefit.
Right, in network, yeah.
And my daughter's is a testament that they will replace them.
Oh, is that right? Oh, has your daughter been eating rocks? Because
no, cantaloupe actually made one of them come off the cement part.
It might have been ready to come off from something else, and the cantaloupe just pushed it the rest of the way.
Pushed it over the edge.
Yeah.
Okay, so what is the difference between the contracted amount and what Delta Dental pays the provider?
I'm sorry. Oh, you are there. Are you asking what the discount is on
Yeah,
the PPO?
I
Is that
guess
what it is?
they're saying what's the difference between a contracted amount and what the
Mhm.
actual payment is to the provider. So that is the payment to the provider, right? That they negotiated a
Yeah.
price and that's what
So
they,
I think we had a slide in there that had a couple of numbers, and I believe it said 39% on the discount on the PPO. In actuality, the PPO discount that the dentists give us is between and 41%. And I think 39% is just sort of an average of those two. But it's a pretty substantial discount, actually, I think. And it just depends on the procedures as to whether the procedure falls in that 28% discount or the 41% discount. So that's how on the PPO, the discounts are actually, that's the range of discounting on the PPO.
okay, so a follow-up question to retainers.
Mhm.
So we have to be covered under Delta Care USA and Delta Dental PPO if you're going to get retainers?
Yes, because you don't have an ortho benefit, a separate ortho benefit on your PPO, but you do have an ortho benefit, the same ortho benefit that you have on your HMO. So whatever the HMO ortho benefit is what the PPO benefit's going to be.
Right, so you can be
Yeah.
on either plan. You don't have to
You
be
can
on.
be on either plan, but you're still going to use the Delta Care USA ortho benefit.
Exactly. Okay.
Mm-hmm.
Okay. So again, and they're asking the question one more time. So just to make sure that that you only have to enroll in one plan, you would use
Mhm.
the PPO benefits for all your regular dental work, whatever you choose to
Right.
do, but anything pertaining to ortho, you have to
Yeah.
use the Delta Care Ortho Network.
That's it. Perfect. That's a little confusing, but I think once you explain it a few times, then you start to understand what's going on. They just did not put an ortho benefit per se on the PPO. Now, if they did, it would be you'd be paying a percentage of your ortho care. If they did have that on your PPO, and believe me, it would be a lot more expensive for you to pay for ortho that way than it will be for you utilizing the Delta Care ortho plan. So it's better for your out-of-pocket expense actually to do it this way.
And we have talked about the PPO being used in Mexico. Is it good for international treatment anywhere? It doesn't matter which country?
Yes. It doesn't matter which country. I call it a worldwide network. I don't know, maybe my boss wouldn't agree with me, but I really think that because you can use it in any country that you're in, it's like worldwide. I mean, there's no place that you can't use it. The reason I use Mexico as an example for you to explain it is because San Diego is very close to the border, and so many people use it in Mexico because of that. But it doesn't have to be Mexico. It could be China or
Okay, it looks like she froze on us again. Uh, so we'll keep on going. Carrie, you froze on us again.
okay.
So
I did. Oh, did you hear my answer about using it all over the world?
we got to China.
Okay, well, if you want to go beyond China, you can still use it.
Great. Okay. And then when they do have to translate the billing, can it be done by the
Yes.
specific person, or does it have to be done by a translator and get it certified?
No, I think it can be done by the patient, I think, or by the member. If you're traveling in those countries, you know what the exchange rate is, I'm pretty sure. And so you would just figure out the exchange rate and let us know what it is. Whatever it is on the day that you have that work done, it might be different when you come home or come back. It could be lower or it could be higher. So you use the exchange rate on the date that you have the services done.
Okay. So is
Yeah.
it possible for my dependent to be on a PPO and myself on an HMO? The answer is no, you all have to be on the same plan. So whatever the employee chooses, the dependents will all be on that plan as well.
Now you'll be on the same plan, but you don't have to use the same dentist. Even on the HMO, you can use a different dentist. Maybe you want to use a dentist closer to work, but your spouse or your kids, you want them to be on a dentist closer to home. So you can split the dentists up on the HMO and use different ones as long as they're in network.
Great. Okay, so I think that answers all the questions. If we missed any, because I know we went back and forth and then we had some technical issues, please type them in the chat now and let us know.
Yes.
We'll give you a minute. Okay. If I'm traveling outside the US and I need an emergency dental treatment, as you mentioned, I can go ahead to it without issue, just show the invoice of the expense incurred and reimbursement when I come back. Now, I just want to make sure our emergency care does not cover the full treatment, correct? Our emergency care.
On the HMO,
Uh-huh.
no, on the HMO it's limited, and I saw in the information that I have it said $90. I'm not sure if it's only $90, quite honestly. I'll be honest with you, because I've heard a couple of different things. I've heard like 150, I've heard 90. I think it just depends on the plan, the
Okay. So, okay. They
using. I'm sorry, go ahead.
Okay. So I don't see anything, but I do know that it's a minimum amount that they will
Yeah,
provide for you. But for
right.
the PPO,
Because
go ahead.
because what you're trying to do when you're traveling like that is get out of pain. So maybe you have an infection and you just need antibiotics, but you don't want that dentist to actually do the work, but you do want them to get you out of pain and help you with any infection you have. And so you're not going to have them doing the full service. You're going to have them doing palliative care. So, because when you come home, that's when you want to go ahead and get the full service done, but you need to get out of pain. If you have pain or infection, definitely you need to get, some kind of treatment. And so it's meant to cover that kind of thing on the HMO. On the PPO, it's covered the same way as it would be if you went to any licensed dentist and they did, like, maybe they started a root canal or something like that. It would be billed out accordingly, according to what those fees were.
Okay. And is there any time limit for reimbursement for those services for the PPO? So if someone went out of network,
I am not really sure. Actually, that's a really good question. I don't know if there's a time limit or not. I want to say, well, I don't want to say that because I might be wrong, but um, I wanted to say like 6 months, but I'm not really sure if it is 6 months. But that would be a good length of time to be able to bill it. I would bill it out as soon as you got back. You could call customer service and ask them.
okay.
Yeah, they would know. They would know how long the claim process would be.
These are all wonderful questions. So
Yes, really good questions.
if you have any more that we missed, please let us know. We'll just give you one more minute and then I will let Nidra take over. Let's see. Does the paperwork from the overseas need to be translated by the dentist's office? Or me. And so I think Carrie said that that can be done by you.
Yeah.
This may have already been covered. What documentation is needed to add on a spouse to my PPO? So if you are doing it during open enrollments, you would go into the PeopleSoft open enrollment system and you would go to that particular benefit, which is the dental, and then you would click that person and make sure that they are checkmarked as your dependent, and it would be effective as of January 1st. If you have a life event, if you just recently got married and you want to go ahead and add your spouse onto your PPO plan sooner than that, you would submit the copy of your marriage certificate within 60 days of the marriage, and then you can go ahead and enroll them, and they would be effective the first of the month after we got the documentation showing that they were that you were newly married. Did we miss any questions? Nidra, I'm going to go ahead and hand it over to you.
Oh, great. Thank you. I appreciate it, Carly. And thank you for your assistance with answering questions.
Yeah.
And Carrie, we would certainly like to thank you for making time to go over all the valuable benefits of the dental plan. I
My
believe at
pleasure.
this time we can conclude the webinar. And I would like to remind everyone that this has been recorded and will be posted onto the benefits website within the next week. And if you have any additional questions post-session, please reach out to your benefits ambassador or the benefits division. So at this time, we'll conclude the webinar. Thanks again, everyone, for making time in
Thank
your
you.
busy day.
Yeah, good questions, everyone. Really, really good questions. So thank you.
Thanks again, Carrie. Bye, all.
Okay.
Bye. Thank you.
Bye.